PrognocCIS Patient Portal gives you multiple options for engaging with patients. The portal landing page has a customizable picture and description of the available features, each of which can be turned off if the clinic chooses not to use those particular features. There is also a Patient Portal app, which can be downloaded from the App Store on Apple as well as Google Play. We also have the ability to custom brand the app for the practice, and your practice's name would be listed in the App Store so that patients would look for your practice rather than the PrognoCIS app. Also on the app landing page, we have instructional videos that the patients can review as well as frequently asked questions, and the patients can reset their own login details. When a patient is added to PrognoCIS and their email address is entered and saved, an automatic email can be generated to send the patient a link to the patient portal as well as a username and password that will need to be reset upon their first login. You can allow new patients to sign up for your practice via the patient portal. You can utilize a book appointment feature, which is geared specifically towards allowing patients to schedule appointments. It has a dedicated workflow that you can walk patients through specific steps, such as making a payment or completing a form prior to scheduling an appointment. This book appointment can be utilized by new or established patients. And then we also have our established patient login. Any of these three buttons, as well as a link to the portal landing page, can be added to your practice's website. First, I'm going to go in and sign up to be a new patient in the portal so you can see the available steps. When you are filling this in, there are just a few details of required information. You can then hit the next button, fill in the specific contact information. Generally, the contact information is required. You can dictate exactly what you will allow them to fill in. You can have them complete this information. This information is related to meaningful use and MACRA. You can ask them to give you some remarks. We have CAPTCHA included for extra security. When they hit the sign up button, it gives them the ability to create their own password, which they can enter. Gives them specific requirements, lets them know if their password contains all of those things. When they hit the submit button, it then creates a patient within your PrognoCIS database. So if you did not create a username and password for them by having that email automatically sent, they're able to do that on their own via the via setting up this login here. When they go to log in the first time, it will have them fill out the CAPTCHA again. When they have logged into the system and have never had a visit in PrognoCIS, it will give them a new patient workflow. An established patient gets a separate workflow, which I'll show in just a moment. So we have 7 optional screens for the patients to complete information. The first being a majority of what they've already completed, so the basic details. You can have them fill in emergency contact information. You can have them enter the insurance information for you, and this list will be the actual insurance companies that you have listed within the system. So from here, it's basically a one-step process once they save this information to run the insurance eligibility within the EMR. You can allow them to schedule appointments if you would like to. They can also do this as a self-service function once they log in as an established patient. So if they've never completed an appointment, you can have them schedule here and then also have them schedule on the home page. You can dictate what types of visits are available for them to schedule within the new patient workflow. To schedule an appointment, they just pick a time slot, confirm it, considers that appointment scheduled, pops the patient onto your PrognoCIS schedule. We also have the ability to just send a appointment request to an individual user within the system to notify that a patient would like to schedule. You can have them fill out patient history forms. We customize these forms specifically for your practice, so gathering allergies, medications, surgical, past medical, family, social history. The patients can do this data entry for you. Again, you give us a sample of your forms, and we take those in HTML, program those to look like your existing forms or forms that you've designed. The next section is legal documents. This gives you the ability to have patients review a form, complete a signature within the system. When they submit this, it goes directly into their record in the EMR. And then we also have a feature to allow patients to upload documents. We now offer the functionality of allowing patients to upload documents within the messaging in the patient portal. So this is less of a commonly utilized feature anymore, but it is available. So if you want the patient to be able to send you progress notes maybe from their previous provider, they can come here, attach a document, attach any of these type of documents from their computer. Once they have completed the required steps, then they will be sent to the regular login screen that an established patient would see. So I'm going to now log in as an established patient so you can see what the landing page looks like for an established patient. After that first visit, they will then start receiving this dashboard as their login page. The options here, again, can be turned off if it's something you don't utilize. For instance, if you're not utilizing our practice management system, the billing section wouldn't be available there. If you choose not to allow them to schedule their own appointments, that section will not appear. They can see appointments that are scheduled, book appointments, see and receive and send messages in their inbox. Anytime you send a message to a patient in the portal, they also receive an email that they have a message they need to log in and review. You can send them attachments same way that they can send you attachments. When those attachments come into the system, you can opt to add those directly to their document lists, and you can classify those in any format that you would like. You can allow them to make payments directly through the patient portal, so statements can be sent and patients can make payments. We work with 5 different credit card processing vendors, so once you sign an agreement with one of those vendors, we attach it to your EHR so you can collect payments at the clinic as well as through the patient portal. And we also have the availability to collect payments through the book appointment functionality. You can have the patient see your contact information here. The health reminders section is utilized for any kind of annual testing that needs to be completed, vaccinations. The health reminders send the patient a message when something is due. They show here on this login page, and then they also are available in your EMR so you can run a report of all the patients that are scheduled for things. They also have a few quick links here so they can request a prescription refill. Each of those quick links just takes them to the section here at the top. So for instance, if this patient wanted to request a prescription refill of their Abilify, they just choose the medication, hit the request button, confirm their pharmacy is accurate, and say submit. That then goes to the provider directly to their inbox in PrognoCIS, and it's a simple couple clicks to approve that prescription and send it in for refill. You also have the ability to share patients' records with them so they can see any past visits that you've shared within the system. You can allow them to see lab trends, educational materials. We have the vaccine VIS sheets loaded in here, so anything that you send through the portal, it will send the patient a message that they have something to log into the portal and look at, and will also show in their list of education documents. You can control what information has been sent to the patient portal and what has not. You also have the option to have patients go and complete forms and legal documents for signature after their initial visit if you would like. They can come here and see their message center. They also have the option to go in, if you so choose, and edit their contact information and to allow authorized users. So if it is a minor who needs their parents to have a login or a patient with a caregiver, they can also come in here and set up authorized users as well. That's the PrognoCIS Patient Portal. We also have, as I mentioned, an app which has all the same functionality except for one additional feature, which is the ability to do telemedicine visits within the app. So patients can schedule the telemedicine visits and conduct those visits directly in the app. If the patient hasn't downloaded the app and wishes to conduct a telemedicine visit, we also send those meeting links via text and email. So the patients don't have to have the app for telemedicine visits, but it is available. And then the other option that we have is called ProCheck-In, which is a tablet-based system. So if you have a tablet in your facility that you would like patients to complete paperwork on, you simply put in the patient's name and date of birth. If they have an appointment that day, it will notify you that they have been arrived, and then it will take you directly to the list of forms. And this is a lot of forms that we have loaded for our demonstration purposes, but most practices will have one for new patients, one for established. So your patients are able to go and log in, complete this information, submit this information directly to you within the EMR. All of the information that is submitted is instantaneous. There's no delay. So as soon as the screen refreshes, your paperwork form will change colors, letting you know that the patients have filled out a form. And we also have the ability to send notifications to staff members anytime patients upload a document, send a message, send a patient form. You can decide if you want those to go directly to the provider, or if you want to designate those to go to a staff member or a group of staff members for your practice.